Welcome to the video. Test your nursing knowledge and pass your NCLEX exam. This covers everything from medical surgical nursing to maternity. Now, let's get started. A client with multiple sclerosis (MS) at 39 weeks gestation is admitted to the labor and delivery unit in active labor. The client's vital signs are BP 127/70 seconds, pulse 72 bpm, cervix is 4 cm dilated, FHT 124 bpm, moderate contractions are 4 minutes apart. The nurse should anticipate the need for which of the following interventions. 1. Prepare to administer IV pitocin to the client. 2. A reduction in the amount of pain medication administered. 3. Check the client's blood pressure every 5 minutes. 4. Prepare an isolette for the infant. The correct answer is 2. Less pain medication is required due to overall decrease in pain perception due to MS. The clinic nurse is performing diet teaching with a 67-year-old client with acute gout. The nurse should teach the client to limit his intake of 1. Red meat and shellfish. 2. Cottage cheese and ice cream. 3. Fruit juices and milk. 4. Fresh fruits and uncooked vegetables. The correct answer is 1. Should be on low-purine diet, should avoid red and organ meats, shellfish, oily fish with bones. When assisting with a bone marrow aspiration, the nurse should 1. Drop additional sterile supplies onto a sterile tray. 2. Have all sterile packs unwrapped for the procedure in case they are needed. 3. Reach over the tray and remove contaminated supplies. 4. Place the bottle of sterile liquid on the sterile field so it does not splash. The correct answer is 1. Sterile articles should be dropped at a reasonable distance from the edge of the sterile area. A 69-year-old client is undergoing his second exchange of intermittent peritoneal dialysis (IPD). Which of the following would require an intervention by the nurse? 1. The client complains of pain during the inflow of the dialysate. 2. The client complains of constipation. 3. The dialysate outflow is cloudy. 4. There is blood-tinged fluid around the intra-abdominal catheter. The correct answer is 3. Indicates peritonitis, also will see nausea and vomiting, anorexia, abdominal pain, tenderness, rigidit. The nurse is observing care given to a client experiencing severe to panic levels of anxiety. The nurse would intervene in which of the following situations? 1. The staff maintains a calm manner when interacting with the client. 2. The staff attends to client's physical needs as necessary. 3. The staff helps the client identify thoughts or feelings that occurred prior to the onset of the anxiety. 4. The staff assesses the client's need for medication or seclusion if other interventions have failed to reduce anxiety. The correct answer is 3. In this level of anxiety, client is unable to process thoughts and feelings for problem solving. A 4-month-old child is admitted with a tentative diagnosis of meningitis. To confirm the diagnosis, a lumbar puncture (LP) is ordered. While assisting the physician with the procedure, it is most important for the nurse to 1. Appropriately restrain the child. 2. Instruct the parents about the procedure. 3. Provide support to the child. 4. Elevate the head of the bed. The correct answer is 1. Primary objective is to prevent trauma to child during the procedure. Child must be restrained. A 48-year-old woman is seen in the outpatient clinic for complaints of irregular menses. The client's history indicates an onset of menses at age 14, para 2 gravida 2, and regular periods every 28 to 30 days. The client is divorced and works full-time as a bank teller. The nurse knows the most probable cause of the client's symptom is 1. Emotional trauma and stress. 2. The onset of menopause. 3. The presence of uterine fibroids. 4. A possible tubal pregnancy. The correct answer is 2. Ovarian function gradually decreases and then stops, usually 45 to 50 years old. The nurse is caring for a 6-year-old boy several hours after the application of a hip spica cast. The patient turns on the call light and complains of pain in his left foot. Which of the following actions should the nurse take first? 1. Elevate the left leg on 2 pillows. 2. Palpate the cast for warmth and wetness. 3. Administer pain medication as ordered. 4. Check the blanching sign on both feet. The correct answer is 4. Assessment, pain. Main symptom of circulatory impairment from cast, pressing nail of great toe indicates circulatory function, compare speed with which color returns with result on the opposite side, sluggish return indicates circulatory impairment, too rapid return indicates venous congestion. The nurse is caring for clients in the skilled nursing facility. Which of the following clients require the nurse's immediate attention? 1. A client admitted for a cerebral vascular accident (CVA) whose prescription for warfarin Coumadin expired 2 days ago. 2. A client in pain who was receiving morphine in an acute care institution and was transferred with a prescription for acetaminophen with codeine. 3. A client who has dysuria and foul-smelling, cloudy, dark amber urine. 4. An immunosuppressed client who has not received an influenza immunization. The correct answer is 1. Duration of Coumadin 2 to 5 days, client at risk for a repeat CVA. An extremely agitated client is receiving haloperidol Haldol IM every 30 minutes while in the psychiatric emergency room. The most important nursing intervention is to 1. Monitor vital signs, especially blood pressure, every 30 minutes. 2. Remain at the client's side to provide reassurance. 3. Tell the client the name of the medication and its effects. 4. Monitor the anticholinergic effects of the medication. The correct answer is 1. Assessment. Monitoring vital signs is of utmost importance to ensure client safety and physiological integrity. Rapid neuroleptization is a pharmacological intervention used to rapidly diminish severe symptoms that accompany acute psychosis. Alpha-adrenergic blockade of peripheral vascular system lowers BP and causes postural hypotension. The newborn infant of an HIV-positive mother is admitted to the nursery. Which of the following would the nurse include in the plan of care? 1. Standard precautions. 2. Testing for HIV. 3. Transfer to an acute care nursery facility. 4. Request AZT from the pharmacy. The correct answer is 1. Provides immediate protective care for the staff members. A client has received an IV antibiotic every 8 hours for 4 days. It is mixed in 100 cc D5W. Which of the following would cause the nurse to be concerned about post-infusion phlebitis? 1. Tenderness at the IV site. 2. Increased swelling at the insertion site. 3. Reddened area or red streaks at the site. 4. Leaking of fluid around the IV catheter. The correct answer is 3 because this is characterized by inflammation and reddened areas around site and up length of vein. The nurse counsels a 70-year-old woman who comes to the outpatient clinic for a routine examination. The history indicates the client takes a laxative tablet twice a day and a laxative suppository once a day. The nurse should suspect the client 1. Has an anal fixation resulting from recent loss of her husband. 2. Is depressed due to alterations in intestinal absorption and excretion. 3. Is experiencing excessive concern with body function due to physical changes. 4. Has regressed due to a fear of losing the ability to have bowel movements. The correct answer is 3, because physical changes occur in late adulthood causing changes in body image, constipation. Frequent problem of elderly, but reaction by this client is excessive. The nurse is performing discharge teaching for a client with Addison's disease. It is most important for the nurse to instruct the client about 1. Signs and symptoms of infection. 2. Fluid and electrolyte balance. 3. Seizure precautions. 4. Steroid replacement. The correct answer is 4 because steroid replacement is the most important information the client needs to know. A client has a history of oliguria, hypertension, and peripheral edema. Current lab values are BUN-25, K +-4.0 MEQ/L. Which nutrient should be restricted in the client's diet? 1. Protein. 2. Fats. 3. Carbohydrates. 4. Magnesium. The correct answer is 1, because decreased production of urea nitrogen can be achieved by restricting protein. Metabolic wastes cannot be excreted by the kidneys. After a client develops left-sided hemiparesis from a cerebral vascular accident (CVA), there is a decrease in muscle tone. Which of the following nursing diagnoses would be a priority to include in his care plan? 1. Alteration in mobility related to paralysis. 2. Alteration in skin integrity related to decrease in tissue oxygenation. 3. Alteration in skin integrity related to immobility. 4. Alteration in communication related to decrease in thought processes. The correct answer is 2, because the leading cause of skin breakdown is a decrease in tissue perfusion. The nurse is caring for clients in the pediatric clinic. A mother reports that her infant's smile is crooked. The nurse should assess which of the following cranial nerves: 1, 3, 2, versus 3, 7, 4, 11. The correct answer is 3, because it is facial, which provides motor activity to the facial muscles. An adolescent client is ordered to take tetracycline HCl acromycin 250 mg PO bid. Which of the following instructions should be given to this client by the nurse? 1. Take the medication on a full stomach, or with a glass of milk. 2. Wear sunscreen and a hat when outdoors. 3. Continue taking the medication until you feel better. 4. Avoid the use of soaps or detergents for 2 weeks. The correct answer is 2, because photosensitivity occurs with the use of this medication. That's it with this video. Check out the website for more free nursing test bank questions. Thank you for watching.